Hey GPers, welcome to this episode where myself, Andy, are going to be talking about the budget and how this impacts general practice and the NHS moving forward. Because of the challenges that this is going to create, we have got an extra special guest, Muffadul Travadi from Everlong Wealth, coming to help us as we figure out how this is going to impact your primary care as we tech enhance your primary care and learning. Hey GP learners, so glad you can join us today as we're talking about the budget and the impact this has on the general practice and the NHS. It came out yesterday. It's been just over 24 hours. We've already had a look at it, and we've even got somebody who spent even more time looking at it, the whole 170-page document that's come out on this as we look at the budget and how it's going to impact general practice. How are you doing there, first of all, Andy?
Yeah, really good. I mean, it's been a really long wait for this budget, hasn't it? It's been 4 months since Labour won the election, and there's been all sorts of speculation about what's going to be in this budget, what might be in, what might not be in. A lot of talk about working people. There was the promise not to raise taxes on working people. So I've spent the last 4 months just asking myself, am I a working person? Is a GP partner a working person? You know, how will I fare in this budget? How will the profession fare? So now we've got some answers, and it's going to be interesting to talk through that. And really pleased to have our special guest here as well. He might want to introduce themselves now.
Yeah, so you want to say hi, Muff?
Yeah, hi. So I'm Muffadul Travadi. I'm a chartered financial planner with Everlong Wealth, and have been in professional financial services, face-to-face advisory for around 20 years. And so, yeah, I'll be looking to share my thoughts and feedback with what I've read so far, and just get a general, sort of add a bit more meat to the bone, really, for you guys out there today.
Yeah,
can you help us with some of those maths questions as
Definitely. Well, we've got some maths coming up for you. Now, just before we get started, because there is financial aspects to this, we are just going to swing this up on screen. So, Muff, I know you wanted to just go through this quickly. So
just the information and guidance that we go through today, is very much going to be sort of like a very generic overview. We can't get into sort of specifics. If anybody does have any specific questions, anything that they want to sort of pick up offline afterwards, I'm sure the guys have got my contact details, and they'll be happy to sort of share them around. And by all means, you can get in touch, and we can discuss specifics in more detail. But we'll try and keep things as generic and as straightforward as we can today.
Yeah. And if you did want to contact Muffadul or his company and stuff, so it's mt@everlongwealth.co.uk. Just because this is not sponsored, there's no, anything along those lines. This is just purely because me and Andy felt we needed a little bit of financial help looking at this, because it's a little bit out of our comfort zone to analyze the budget in its entirety. And there are definitely impacts this is going to have on individual clinicians, the health service, and absolutely general practices in particular. And that's the part we're going to focus on in a second. Andy, I saw your hand. Go for it.
Yeah, I was going to say, just so people know what's going to happen. So I think we're going to just talk generally about the budget, perhaps for a few more moments, and then we will be structuring what we're doing around the BMA's response to the budget, which looks at kind of the impact on the health service, the impact on individual GPs as individuals who work and pay tax, the impact on practices, and then a few other elements in terms of the impact on research and development and sort of international aid and things like that. But I think the main bits will be GPs of individuals, and the impact on GP practices as well, with some of those changes for employers. So that's what people can expect.
Definitely. So I think if we're talking about the budget itself, obviously quite significant. First Labour budget itself in terms of what's come through. People have been waiting a good few months for this ever since Labour came into power. And this seems to be, I think Richard Reeves said that this is setting the tone for the next few years, isn't it, Muffadul?
Yeah, I think this is what we're going to certainly see more, in terms of an emphasis on government spending, an emphasis on sort of raising a few more tax revenues. I think they've gone quite hard, particularly with this initial budget, and we'll be interested to see the £22.6 billion that they've said is going to go to the NHS. It'll be interesting to see how that's spent and where that's spent.
Well, interestingly, that's what we're going to start with. So we're going to have a look at the health service first of all. So particularly, as Muffadul mentioned, there's 22.6 billion being given to the NHS. Now, interestingly, there's questions around what this money's actually for. We're going to cover that in a second as we bring it onto screen. But the question about whether this is conditional or not is still a little bit unclear from what I've been able to understand from the documents. If you listen to the ministers, this is money that's going to the NHS, but it does sound like there are some conditions behind this. So is this linked to reform? Pretty much the answer seems to be Yes, it is. So let's have a look at some of that, shall we, Andy? So you wanted us to take a look at this document first, wasn't it?
Yeah, so this is the first time that I've actually looked at the budget document itself. We have the speech, and then there is a document that's released by the government to complement that speech, and it provides all the detail behind those headline announcements. It's 170 pages, so it's really, really long. I've not read all of it, but there were perhaps just 2 tables that I thought it might be worth beginning with. So this is the table. So what people will see is this is the changes to the departmental spending in all the different government departments. It's just interesting to see the increasing in health sits next to other government departments. So we have that 22.6 billion increase 24-25 to 26, representing a 3.4% increase in health and social care spending. That sits next to education, which gets a 3.5 increase. Home Office is going down 3.2. Justice gets a good increase at 4.3, for example. So it's interesting. And I think in cash terms, the health service has the biggest cash absolute increase in spending of all the government departments. So I thought it was interesting just to put that into context. Screen's going to whiz just as I go to content, so I can just click down to the health section. So and then in terms of, I think it's in departmental settlements, and health is the big one. And here they sort of break it out in terms of normal spending and then also capital spending. And I was going to actually, Muff, there have been some changes to the fiscal rules. People have been talking about this a lot, which my understanding has enabled more capital spending or capital investment. It sounds really, really complicated, but is there anything you do to help?
It is. It is something. It's the way that they account for it, basically, and that has changed the dynamic in what they can borrow and what they can spend. It is complicated. To be honest with you, it requires a lot of thought power to get your head around it, and it may sort of be outside the scope of today's talk to an extent, because it is quite complicated, quite in depth. But if anybody does want to get into the nitty gritty with it, we can certainly have a look at it for you.
Yeah. I think they did something to change how government assets are counted, relative to liabilities, which enables the government balance sheet to look a little bit more healthy and therefore allows them to borrow more money. It's something like that, isn't it? But yeah, I'm sure there's other places that people can learn more about that.
And when you look at the impact of that, that is quite a significant change in the allowing sort of the borrowing of percentages moving forward. So it is a significant accounting change, which has led to the position that we find ourselves in now.
Great. So that's where some of the capital investments come from. Shall we jump to the BMA document and jump into the nitty gritty? I can see people are already asking questions, and particularly around, are we going to calculate the impact of practice finances, which we will attempt to do.
Yes, and we do have a calculation for you as well. So for those questions that are coming through, we do have some numbers. So do stick around for that section. But I guess the first thing is how this money is going to be spent. So interestingly, what isn't mentioned in the departmental spend of the 22.6 billion is how much of that is going to general practice. And the reason why that's important, there is an absolute focus in terms of how this money will be spent to bring down things like the waiting list times, in terms of operations, in terms of having an impact, in terms of test centers and that kind of stuff. There's, I believe, 1 billion been put aside for dealing with the RAC issue across the NHS in terms of capital investment. The reason why that's significant is actually they estimate that the actual cost of fixing the RAC issue for the NHS is about 13.8 billion. So a little bit shy in terms of the actual need for that level of investment and things. But there are definitely some headline sections in the health services part that probably worth looking at. Are we there yet, Andy?
We are. We can click through.
Yeah. So it does talk about the additional spend. So we've got the initial part, and these sections are quite useful. So 22.6 billion going to the NHS. Remember, that's the NHS in totality. There is a separate fund of 6.6 billion going to the devolved nations, and that's split by the different nations. 3.4 billion for Scotland, 1.7 for Wales, and 1.5 for the Northern Ireland Executive. And that's additional investment going into housing, health, and various social care aspects. A little bit lower down, it talks about the RAC stuff, I believe. When we get there, it's probably a bit later on. We can go back to Andy. Get maybe back up a bit if you. Yeah, maybe it's a bit later then. It's in the capital spend. Yeah, there we are. Gone down. A little bit lower, Andy.
Oh, okay.
Yeah, the capital spend bit. Sorry. You're going too fast for me. There we go. So it mentions here about, obviously, the focus in very much this seems to be around trying to bring down the waiting list. And that's obviously because that's a key pledge by the government that they want to bring that down, and about tackling aspects like diagnostic capacities, other kind of aspects as well. I remember somewhere in the detail on the departmental spend, it talked about 26 mental health emergency units to try and support people not having to go to A&E for mental health crises. I think that'll be very much welcome information that comes through, as well as support for bill addressing the capital estates and general practice for 200 practices across the country. Noting the fact, yeah, there's
we got across the country, Gandhi. It
must be about 7,000 to 7,500 across the country, of which I'm pretty sure more than 200 are in state of disrepair. I mean, if you go for Nottingham alone, I believe there's about just 30 across Nottingham that probably would be at a significant point where they are over capacity and don't have enough room to deal with things. So whether they would fit within that 200, I remember seeing on one of the LMC forums about the fact that that's 200 practices is just the amount in Hertfordshire alone that would need addressing. So there is questions around how much impact the capital spend and the other aspects will have in terms of tackling the actual need across the NHS. Any thoughts on that, Andy?
Yeah, so I mean, I guess we're waiting for the review on NHS spending and the new 10-year plan for the NHS, which will be coming early next year. Wes Streeting is currently doing his engagement and listening exercise around that. So I think we will have to wait for a lot of the detail about how that will be spent, and we'll talk about national insurance and minimum wage contributions, but that will eat up a lot of any money that will go, that will be going to the NHS in the future as well. There are some individual measures mentioned in the budget, but still a lot of question marks for me about how that will be spent and how much will be coming to general practice. There's, one of the Darcy diagnoses is that we need to move from hospital care to primary care and community care. So, hopefully we will see that backed up with some spending to make it happen. But Muff, what's your thoughts about the spending?
It's really interesting. It's really interesting. I mean, they've given this great big headline figure of 22.6 billion, which sounds great. It's really interesting to see how that's going to distill down into the relevant departments, and see what kind of impact ultimately that's going to have. And now Rachel Reeves has taken a big step here in that she has gone big with her budget. She's gone big with spending on the NHS, and I think general public will want to see improvement relatively quickly. I don't think they're going to be given the amount of time that they think they're going to be given before people start saying, well, actually, we're paying more tax now. What are we actually seeing for that tax increase? Where's the actual material benefit within the NHS?
Mm-hmm. Definitely going to be an impactful part of it. And I think one of the key things that, like you said, will happen is this almost court of public appeal perception, that's going to happen in terms of, like you say, that all this extra funding that's being generated by everyone having to pay more tax. Where is that going to go? How's that going to be used? How's it going to be spent? We're not probably going to see the outcomes of that at least for a year. Let's be clear on that point. So,
I agree. I agree.
It's going to take a good year or so. We'll probably have another budget done by then. But that's important to recognize that these aren't things that are going to suddenly mean that tomorrow you're going to have a waiting list gone down. It's going to take a lot of time for that to happen. But it is a plan that's set up for the next, few years to deliver that and things.
And we have had 14 years of a Tory government, which towards the end of that, I mean, we've had a pandemic, we've had, Putin and Ukraine, there's been a lot going on. But if you look at public services, not just the NHS, but also, education, there is definite need for investment. And it's investment, which is the word that she used when she started her budget. It's definitely the investment that is needed. And investment, isn't something that happens day one and you see the results day two. It's going to take some time for these implementations to come in. And I think, and again, you guys will know more about this than I ever will, is what kind of reform is going to be brought forward? What kind of changes is she going to, or the government going to think about in terms of that? I think that's also going to be a big value add moving forward as well.
Definitely.
Yeah.
So we're next going to talk about the impact on individual doctors. Just before we get to that, so Andy knows I love doing this. So we've got 100+ live viewers joining us right now. So that's amazing to see that so many of you are joining us live. And probably because you want to hear about the impact this is going to have on you as individuals. And that's what we're going to talk about this second. So this is around the individual tax changes that come from this. I guess the headline one that we know has come up is the fact there is actually no change to individual tax boundaries. I've forgotten the exact word for it.
Taxes on working people,
thresholds.
isn't it? So it's personal national insurance we pay and income tax and VAT. So those solidly in the area of working people. And we knew that before the election, I guess, and they've stayed good to those promises. Yeah, what are the other big changes in terms of taxation of individuals, Muff? What was in the business?
So I think the big thing to take away from this is that there's been no change in the headline rates, but there's also been no change in thresholds. And what we're getting is something that a lot of economists love talking about right now is fiscal drag, and that is as the allowances stay frozen, okay, and everyone's earnings start creeping up, more and more people get caught in higher rate tax bands eventually. And that's really where, until 2028, we're not going to see any changes to those tax bands. So your basic rate allowances, your higher rate thresholds are all going to be pretty much fixed where they are. And the expectation is that as people's wages inflate, they will effectively get caught more into this tax moving forward. Now, 2028 is the fixed date. A lot of sort of thought was around whether she was going to move that date to 2030, but of course this has been her first budget, so we don't know what we're looking at moving forward. So that fiscal drag could continue for the foreseeable future.
I've got a question. So somebody's asked the same question in the chat, actually. So this is jumping into some nitty gritty, but they were talking about changes to capital gains tax, prior to the budget, and they have made some changes, haven't they? Which I believe is moving the rates of capital gains tax to harmonise them with capital gains tax for property. Now, where this might be a particular concern for GPs is where they own their building, and they might dispose of their share of that building as they perhaps leave the practice to move on somewhere else or potentially retire. So somebody asked that question in the chat. So does this budget change that situation, or with it being a property, is that something that's unchanged? Is that clear?
So it depends on where that property is positioned. It depends on how that property is treated. So whether it's treated as part of the business or whether it's seen as a separate entity, because there's been certain changes to capital gains tax. So let's just go through what those changes to capital gains tax are. Property, as in, let's say you had a second house, capital gains tax is charged at 18 and 24%. Okay. And what happens is the value of the gain gets added to your income, and then as you move up the tax bands, you're falling into more the higher rate tax. So the 24% becomes more valid. For shares, it was 10% and 20%. And what's happened now is it's moved up to 18 and 24. So they've actually realigned selling shares with selling property. So that is as of today. That's live. Okay. What's also changed is what is known as business asset disposal relief, what used to be called the old entrepreneurs relief. So that was the first £1 million of disposal was taxed at 10%. That is now going to be 14 and 18% over the next 2 tax years. So that is again increasing to all be in line with the 18 and 24% tax brand. What's interesting to note here, though, is that capital gains tax still remains lower than your income tax position for higher rate and for basic rate.
Yeah, because people were afraid that might go up to the rate of income, weren't they? So that's
Correct.
Something I guess that they've held off doing in this budget, which is worth noting. And yeah, thanks for that detail around the disposal of practice premises, and that the business asset disposal rate might, but that might be a factor. I hadn't thought about that. And obviously, we're not talking about individual cases here anyway, are we? But so that would be a complicated area, and people would get advice at the time. But I think you're saying not a huge change in terms of the position there. Is that what I'm hearing?
I mean, there has been, if you're selling shares, there has been a significant change in terms of, what you used to pay to what you're paying now.
Yeah.
But
the property disposal, I guess.
Maybe we're getting in the weeds. Really changed that much.
Yeah, so maybe we're getting in the weeds here, but it will be a consideration because owning premises is a big part of being a GP partner for many practices. So it will be a consideration for a lot of people out there. So I guess they'll get some specialist input on that if they are disposing of things. Sorry, Gandhi, interrupted the flow there, but
no, it's all good. It's detail that people often want to hear. I guess if we're looking at some of the other detail that comes out, so when it comes to the individual stuff, and the BMA have quite helpfully summarised a lot of this for us. So as they mentioned, no change to individual tax rates. Individual personal income tax and national insurance thresholds remain frozen. We will come to employers' national insurance in a second. The state pension will increase by 4.1%. So this is the triple lock that continues to remain, which is definitely relevant for those coming up to retirement and things. And no further detrimental changes in terms of the annual allowance, and the tapered annual allowance were announced. Now, this is the one that I know the BMA were quite disappointed about, that there was no change in the rules around these aspects. I know this is an unbelievably complicated area, very much individualized, Muffadul, but can you just break down why this was probably significant, particularly for, I guess, GPs in particular, how this would have an impact and stuff?
Yeah, I think because a lot of GPs continue to remain within what is known as sort of final salary defined benefit pension schemes. And it's the way these are revalued. So a very small revaluation in your defined benefit pension scheme can result in a very large annual allowance contribution. And I know from working with clients in the past that a relatively small change in their overall income can have a massive impact on the tax burden and in terms of their annual allowance. Now, the annual allowance has moved from 40,000 to 60,000. So that's, I think part of that has been to try and address some of the issue. But obviously, I don't think, the BMA document, they're saying that they haven't gone far enough in their opinion.
Yeah, was that in a previous budget, I think, from 40 to 60. And then I know prior to this budget, I mean, there was some concern about all sorts of things that the government might do. But there was, I think, concern about removing some of the tax relief that people get on pension contributions, potentially from higher rate taxpayers. So again, that's something that they haven't done. We're talking a lot about things they have done that might be detrimental, but there are to individual people's finances, but I guess there are things that haven't been done as well. So it's just worth kind of marking and acknowledging where things were speculated and they haven't been done. They haven't gone that far. That's something I was worried about.
Yeah, quite. And there was a lot of talk about the 40% tax being, being far too generous. But I think the way the government have looked at that is you have to incentivize people to save. Okay, and to save for the future. And I think that removing that level of tax relief would have been detrimental in terms of seeing people saving, because the reality is that 85 to 90% of the UK population is underfunded when it comes to their retirement provision, and the only way to encourage them to save more is by giving them incentives to do so.
Yeah, and I do wonder if they might have seen an exodus of higher rate taxpayers from the NHS pension scheme, because we can't choose how much we put in our pension. We can be in it, or we have to put the high rate in if we're high earners, and we can't choose one or the other. So, and a change of say 20% in the tax relief would have made a huge difference. So I could have seen a lot of people electing to leave the NHS pension, causing a lot of upset and maybe affecting like the overall kind of viability of that scheme, because I understand that the higher rate taxpayers actually fund that scheme quite well compared to what other people put in and take out, for example. Gosh, this is getting pretty technical, isn't it? This
is, and a little bit more to come.
Enjoying it.
Well, they seem to be. We're now up to 127 people live. So I love going to the count. It just makes me all happy and detailed in there. So we've already talked about the capital gains increases. There is the freeze on inheritance tax. So that's the £325,000 individual and stuff. Have there been any other changes around inheritance tax that would be relevant, do you think, Muffadul, that worth discussing?
Yeah, I think so when we talk about inheritance tax in general, in 2007, the inheritance tax threshold was £325,000. It will remain £325,000 until 2030. Talk about fiscal drag. That has been the biggest fiscal drag we've seen is people's assets have grown over the last 15, 20 years, and that allowance has not changed. Yes, you do have the residence nil rate band. So that is a £175,000 additional allowance per individual that they can offset against their main residence, as long as their main residence goes to direct dependents, so children, grandchildren, and so on. What is a fundamental change to all of this, and I think Rachel Reeves slipped it in, and she definitely did slip it in when she was talking, is that the fact that unspent pension funds will come into inheritance tax from 2027. Now, this is huge, because for the last 10, 12 years, our advice has been, don't spend your pension fund, use other assets, because the pension fund can be passed on outside of inheritance tax. And it looks like that is going to change, and that is going to fundamentally change our outlook for people. Now, the fact I think that's coming in 2027 is there's going to be an absolute truckload of legislation, consultation. There's going to be so much work that needs to be done before these things come into play. But I think the fact that she's slipped that in already just shows you the intent of where they're looking to go with inheritance tax, especially around pensions.
That's interesting. I hadn't noticed that.
The doom and gloom.
No. And we haven't even got to GP practices yet. But just before we do get to that, one thing that the BMA hasn't commented in their document, which I know will have some bearing on particularly a lot of GPs, and I know that this is put because they are in a slightly different echelon of the way that they earn and things, is the impact on the VAT charges for schools in particular, for private schools in particular.
Yeah.
So that has gone through. Many people were anticipating this was going to happen. This was, a Labour Party pledge. I guess we've had a little bit more detail as to what that looks like. So it's from effect, correct me if I'm wrong, Muffadul, from January in terms of the impact. However, that is applicable based on when your child was in school from October. So effectively as of yesterday. So there's not really a way around it. I know some places we're looking at ways to get around the charges and stuff in terms of bulk paying for a year effectively.
I believe HMRC have also looked at anti-forestalling legislation around this as well. So for people who thought, what we'll do is we'll front load a load of school fees, they're going to find that actually, the VAT will be subject, and will apply to that happening as well. So, a really, a very controversial thing that's come out.
It's political, isn't it?
Be there.
So, yeah.
Very much a political one. I guess there's the big question of whether or not the state schools will be able to cope with the potential exodus of people leaving private education because of the costing. A 20% increase is not a small amount when you're talking about private fees. So we will wait and see on that particular one in terms of the individual aspect. I think also
what's really important about that 20% increase is that's paid from net income. So once you've effectively you have to earn the income to net it down to be able to then pay the 20% increase in VAT. So it's not a small increase by any stretch of the imagination.
No.
Yeah, you're right. The income required to pay those school fees is huge, isn't it? Particularly if you're talking about the types of marginal tax rates that we have at the upper end.
And if you're in higher rate,
Definitely. So this is probably the part that most people have been keen to listen and watch out for. So this is the impact that we're going to see on general practices as businesses as organizations. The BMA has a really good summary on this, so we will go to that right now. And I guess the big headline thing that's come through from this budget is the change to national insurance contributions. You know what, Muffadul, I'm going to ask you to explain this one, because the first time I read it, it made my head spin. The second time I read it, I was still spinning, and it took me about 5 reads to understand what on earth has actually changed for national insurance in detail. So do you mind taking this on?
Sure, fine. So headline rate change. So employers' national insurance is going from 13.8 to 15%. That's a 1.2% increase. Alongside that increase, fundamentally, they've also reduced thresholds. So the threshold before you paid national insurance was 9,100. That's now moving down to 5,000. There is a smaller businesses, a secondary allowance of 10,500. But in the main, what we're seeing is an increase in the rate and a decrease in the allowance. So there's that double whammy impact in terms of purely national insurance. Now, alongside that, I don't know whether you want to talk about the increases in national minimum wage, because I think the two of those can go in tandem. Go on.
Yeah. There was a figure of I think 10,500 in terms of some sort of relief for small businesses, and a lot of GP practices will think, are we a small business? Are we a medium-sized enterprise? How helpful will that be for us? So what does that mean, and how helpful is that?
It effectively covers about four employees, I believe. It pays the national insurance for 4 people. And again, it is a bit hazy as to what that actually means. And we're currently looking at, understanding the legislation more around what exactly that allowance is and when does that apply, because it almost looks like there's a bit of a red herring that's been thrown in there just to confuse people even more.
Yeah. So you were about to talk about the increase in the minimum wage as well, because I know what a lot of people were doing this morning, and we did the same in my practice, is we got out the back of an envelope and tried to calculate actually what does the combination of the increase in minimum wage from, is it £11.44 to £12.21? What is the impact of that, given that we have a lot of staff on minimum wage at the practice, and people will do across the health service, and actually a lot of our other staff are not necessarily minimum wage, but they're just a little bit above it, and we need to respect that differential between what the the basic wage in terms of the lowest members of staff and those people supervising them. They need to be paid more. So everybody's going to have to go up by some amount, and then of course we're paying increased employer national insurance on that. I mean, we're just trying to work out what's the headline impact on the practice, because this is the biggest change that affects practice finances as far as we could see this
before morning. We do go to that, so this is a direct response to a question we've had. So I'd like to ask if anyone's got a cheat sheet estimation for NI increases for employers. So I know Muffadul's been doing some calculations to help us understand this and things. So let's go for it, shall we?
So I mean, what I've done here is very simply, I've just said, well, if you had somebody who was working a 35-hour contract on the current minimum wage, and they then move on to the new minimum wage, along with the changes in national insurance, what impact does that have? And I've calculated the cost is going to increase by around £2,300 for that particular individual. Which equates to about 10.55% increase in the cost of that particular individual. I've also calculated if somebody's earning £30,000 a year now, what is the increase in national insurance going to be for that individual? And that comes in around about £865 or around 2.8% as an increase for that particular. And so you can see that as you have more people at the lower banding, the impact for that business is going to be far greater than businesses that have got higher earners.
Mm-hmm.
Okay, so I mean that sounds like a lot of GP practices, given the recent increases in minimum wage, will have a lot of staff at minimum wage. Gandhi, I don't know if you agree with that.
Well, I definitely agree with that in the concept, because let's think about it. Majority of staff that we have in general practice are reception and our healthcare assistants, and those kind of pay banding. So they are generally people who are minimum wage up to about, let's go for £14-15 per hour. So I would estimate majority of practices well over 50% of their staff will be at that banding. Then you will have those that are obviously more middle grade pay, so you're 14 to 25 pound per hour. So that's your nursing staff, your physiotherapists, your clinician levels, your management levels, and then above that you'll get into what is typically the most expensive members of staff, which is your GPs. Which generally,
and nurses and pharmacists,
and nurses, prescribing nurses and pharmacists, which will then generally be your £25 per hour plus. If you look at average salaries GP contract, you're looking about £40 per hour in terms of their income rate. So, when you balance that in terms of the NI costs and stuff, I've seen figures of £615 for every full-time equivalent staff member is your basic pay increase that you're going to have to look at as a business. Is that correct?
Yeah, I think because as you get into the higher levels of income, the 9,100 to 5,000 drop becomes less significant, and then it becomes the 1.2% increase that you're actually getting. So, yeah, like I said, I'm just working on a £30,000 a year salary. You're talking about £865, thereabouts, sort of as an increase purely in just the changes in national insurance.
I mean, the figure that we came up with on the back of a no one smokes, so it's not a fag packet, but an envelope this morning was in excess of £50,000. In excess, that was we could modify the model we were using to be more accurate, and the figure would probably only go up, which is a lot of money for a GP practice to find. Now there is more spending coming through. We're aware of that, but a lot of that spending is going to be eaten up by these additional wage bills, aren't they? Or service, or if this is not, if this funding is not passed to practices, then we might have to look at reducing service provision. We were talking before we went live, about the levers that different types of businesses have to pull when they have to manage a cost increase, and many businesses will be able to put up their prices, but obviously we can't do that. The government might inadvertently put up the price by giving us more money, but we're very beholden to government for that. Have you got any thoughts about how we might mitigate these impacts, Muff, or any advice for practices or further comment?
To be honest with you, I've been sort of considering, there's not a lot you can actually do to get around paying minimum wage. There's not a lot you can get around paying employers' national insurance contributions. Of course, there is, the opportunity for pension contributions to be made via salary sacrifice, and that means that that may be an option for some people to take on, a remuneration method, maybe to put some funds towards the pension and use that. But again, I can't see where you're going to, move around this. It seems quite restrictive in its approach.
Yeah, we our conversation started to drift towards actually fewer, better trained staff, not making anyone redundant or anything, but just in terms of the evolution of the model, looking at actually investing in training, software processes to support the efficiency of the staff that we've got, and actually just trying to do more with probably less staff in the future. And maybe that's the direction that we should be going in the NHS anyway, and maybe that's what some of the reforms will be about, in terms of getting more bang for buck in terms of spending. But that's where the conversation began to drift, really. But it must be clear, we were not talking about making anyone redundant, but just in terms of that shape of what we want to look like in the future. It was making us have those sorts of conversations. Gandhi, have you spoke about this in your practice or across your group practices?
So we haven't talked about it in great detail yet, because obviously it's quite live information and it's been 24 hours. I guess there's a couple of other things to bear in mind. So one interesting thing, and I'd love to know if Muffadul agrees with me on this one. So theoretically, someone who's already retired but come back to work suddenly becomes a little bit more attractive, because I believe you wouldn't have to pay their national insurance contributions. Is that correct?
So if they're drawing their state pension,
right? But
if they're drawing their state pension, yeah, I believe then you don't pay national insurance once you are drawing your state pension. But yes, but then you're talking at someone who's 67 years old, or 66 years old. Or
Having said that, we have many GPs or other clinicians, our reception staff who are coming up to retirement age or at retirement age, drawing their state pensions, who still want to maintain work. And actually, that's valuable experience that suddenly becomes a little bit more valuable, actually, because they are theoretically slightly cheaper members of staff. That's not necessarily to say that, there'll be an excess of people looking to employ them, but I think it's something to consider with your staff who potentially towards that retirement age where actually they may have more value to the practice from a financial perspective. I think Andy's right in terms of the fact that general practice probably is going to have a look, an internal look to reconciling how it does its staffing aspects. Redundancy is a weird thing in general practice. It's generally not something that's done in the healthcare service, because it's, for a start, the NHS rules around redundancies are really quite detailed and specific, but also the impact that would have, it's generally not done because we always need more people. Let's be honest.
And
we just
there's
need
always
people.
There's always a bit of staff turnover as well, particularly around reception and admin levels that mean you can normally change your shape organically as staff turnover. But interesting.
So, but one thing I do want to go to, which is a comment made by Sakib. So much of the recent pay rise that was in the contract value of the 7.4% could be wiped out. I think this is a really important point to mention. So yes, general practice, a few weeks back, got a 7.4% rise in the contract value. What's really important to recognize is that increase in the 7.4% was actually to balance out last year's pay rises of the minimum wage increase to £11.44 and this year's pay increases for many staff and the functioning of the impact of inflation and that kind of thing. That 7.4% contract increase that general practice received in no way covers the increases that we're about to see from national insurance increases and the minimum wage increase for next financial year. We just talked about it. For an average 10,000 patient practice, you're talking upwards of £50,000 of extra staff costs just on those two aspects alone. That will not be covered by the 7.4% global increase that we've seen. And actually, I think there are many practices where they are going to have to be looking inwards as to how can we be more efficient and more effective if there is not a further contract negotiation. And that's the big if that we don't know at this point, given how live it is. And this is absolutely the thing that the BMA talk about in their documents, in terms of the fact that obviously there are still ongoing negotiations around collective action and the impact. I guess for those who are very anxious around this, important to recognize that in the next few weeks, there are some key dates to be aware of. So on the 7th of November is the GPC's next meeting. There is the LMC England conference on the 15th of November, I want to say. I should know that because I'm going for it. 22nd of November. I apologize. It's the third Friday in November, 22nd of November. There you go. Which is the LMC England conference, which I am aware that the government, particularly West Streeting, will probably be looking at that in terms of how that grows, because there is this absolute recognition that if you have these increases, but you want general practice to do more work, particularly with that left shift of workload for, improving patients' time to get to their operations, more shift of hospital care to community care, you need to have capacity. In order to have capacity, you need people to do the work. And in order to do the work, you need to pay them. So that has to exist. So although I know many people are very worried about it, quite rightly, very worried about the impact of national insurance increase of minimum wage, I think there is important to recognise there is some detail we don't have yet just because of how live this is, and whether those impacts will still be the case with the upcoming contract negotiations and other aspects is yet to be determined.
So watch this space. Yeah. I had another question. It's about corporation tax, actually. So most GP practices still probably operate as partnerships, but some of us will deal with other types of organizational structures, like limited liability corporations. So a lot of GP federations will do that. A lot of large providers will have bits of themselves, which are limited liability corporation, LLCs. Has there been much change around corporation tax in the budget?
No, there hasn't. I mean, it looks like it's going to remain a sort of 19-25%. They look like they haven't really fiddled about the corporation tax too much at all within this budget, which is good news.
So not much, not too much for those people to deal with who are dealing with those different sorts of organizational structures, which some people will be.
No.
So that's good. I'm sort of grasping for if there's if there's any good news. I guess we found some things that they haven't done, around pensions and all sorts of other things. But key points for population health is the next section on the BMA's breakdown, because they always fiddle with things like tobacco and alcohol duty and other things in budgets, and they've sort of broken down those things. So it's probably worth having a look at those, because this is where perhaps there are some positives.
Although admittedly the BMA starts with a negative first of all, which was no uplift for public health grant in the budget itself. So recognising the fact that a few years back there was a significant stripping of the public health budgets themselves, this has obviously an impact in terms of services like social health clinics, stop smoking clinics, child health services, and that kind of stuff. So there's not been a rise in those. There has been a rise in universal credit of 1.7%. So no, is a rise. You're right. There's not much in particular for deprived populations. That's going to be an impact. Absolutely.
Yeah. I was going to say, look, this is, if I think, connected to where the inflation rate is at a particular point of the year. It says here in September, and I think we had sort of the lowest rates of inflation in September of the whole year, for example. So some people have said it's unfortunate that it's tied, to September's figure, and could have been higher if it's tied to other parts of the year, and that that might not help people who the poorest people in society as much as it might have done, compared to the sorts of wage rises people get. That's not necessarily keeping pace. So that's interesting, because we deal with a lot of people in those categories, don't we, Gandhi, who are really suffering to pay for their rent, their food. They're going to food banks. Universal credit isn't stretching far enough for them. So it's worth sort of noting that as well, in terms of can more be done for the benefits side of things, or tax credit side of things.
We did, however, see increase in duty, particularly in terms of tobacco and also in terms of alcohol, although a slight drop in draft alcohol, if I remember rightly, 1p. Maybe that's to help with...
Pint at the pub is cheaper. It's a bit of a headline grabber, I think.
Definitely. There is also a bit more of a focus on vaping. I know, particularly in the medical profession, vaping is an interesting topic as ever to discuss. And then the last one is this 115 million.
Vaping is going to be taxed from 2026, isn't it? I think they're going to begin taxing vaping. I think quite a low rate initially, but that's something that we may see increasing, as time goes by. Sorry, carry on.
Yep. And then the final one is the 115 million investments to support individuals with disabilities for health and conditions into work. This seems to be slightly different from previous governments, but it does mention the reflection and similar plan that was there from the Tory government as well, later down in the detail, which will be interesting to see how that matures, because obviously there was concerns around how that would be applied in terms of the those particularly more vulnerable populations that would be earmarked for that. But it'll be interesting to see how this filters down to the detail and whether this has an impact directly in terms of what they're trying to do, which is obviously get more people back to work.
Yeah, because some of the narrative around the state of the economy reflects on the fact that we have record numbers of people who are claiming disability and incapacity benefits, and could the health service do more if better funded to help those people get back in a position where they can work, due to improving their mental or physical health. So that feels like a significant thing. Whether that's enough money, I doubt, but conceptually that feels important to me in terms of getting people who can work back working. So nice to see it acknowledged.
So at this point, I think what we're just going to quickly do is go through the final few sections of the document. We're going to whiz through these because these are slightly less detailed. And effectively, the first one was healthcare innovation, which is something me and Andy obviously love when we talk about healthcare innovation. It does talk about some extra money for New Lifestyles Innovation Manufacturing Fund, which there's not a great deal of detail of this, but this is effectively research and development. It does talk about further investment in the NIHR groups, the National Institute for Health and Care Research, effectively just trying to look at how they can use other technologies and aspects more effectively, and the recognition that actually research does eventually pay off in the long run in terms of obviously abilities to have better treatments, hopefully cheaper treatments and other stuff. The interesting one that me and Andy are going to talk about for next week, that many of you may want to join us, is the National Data Library. Andy, do you want to comment on this one?
Yeah, so the government will also create a national data library to unlock the full value of public data assets. So I think the implication here that this is not just health data, although that's always talked about as a potential source of sort of untapped value in terms of the understanding that we could get from that about people's health and population health, and to help us identify and treat disease earlier. There's also value in that health data in terms of value to other users, so researchers or organizations, even companies that might have a use for that data in terms of finding new treatments and products and so forth. So this is about using health data to unlock those improvements, but also they talk about other data as well, so policing data and data from other parts of public services that might help us be more efficient in terms of how those services run. I think I might have made a bit of a hash of that, Gandhi, but I think generally that's the gist that I got from it. And they're setting the wheels in motion to create that. There's some of the aspiration there in terms of what they're announcing, but not really the detail as far as I've seen. Mentioned AI a few times as well.
AI is the darling of 2024.
What did you take away from this?
Well, it's the creation of this data library that Wes Treating was talking about back at the RCGP conference, we think. To be honest, Andy, I know we're going to cover that in more detail for the next episode. So how about we just tell everyone to watch that episode instead, because it will probably clarify some more stuff. There is more stuff the BMA talks about. We're not going to go into those because we think that it's self-explanatory in the document and stuff. So do feel free to have a look at that. That's things like
international aid. Things like
international aid and tackling structural discrimination and things, and it's fairly well summarized in the document itself. I guess what would be worthwhile talking about, so we have had a couple of questions come up. So one that's come from Sakib: I wonder if the R's funding would be uplifted for NI. If so, would that set a precedence for practice level funding? So I guess just a reminder for those that the additional roles reimbursement scheme are part of the PCN DES that has not had a costed increase in the DES, that actually PCNs were pretty much told to find the uplift funding from themselves. This is going to be an additional funding element that needs to be found. So the question of whether that will be uplifted or not, I think will be, again, pending the negotiations by the GPC in terms of any further contract negotiations. But I suspect the answer to that for this financial year, this will probably be no, because they would feel they've done a lot of that. I've got a slightly more specific question for Muffadul, and I appreciate this is slightly more technical. So Medi Mentors asks, are GP partners excluded from the rise in employers' national insurance? So I'm going to ask that part first. So just a reminder that as GP partners, you still have to pay both the employee and the employer's contribution. But would that be different in this situation? I don't think it would it?
I believe so. If you are salaried within the practice, and if you draw a salary from the practice, now I know directors sometimes of companies don't have to pay employers' national insurance, but I don't know if this works in the same way. I mean, certainly something that we can investigate, take away, and I can come back to you with some firm response on that. But my initial, if you're saying, look, we are actually part of the practice and we're taking a salary from the practice, then I think the answer to that would be then you probably have to pay your own employee and employer's national insurance. But we can definitely check that out and come back to you on that one.
I think we probably need to go away and look at that, because I think we pay a different sort of, we do pay national insurance as partners, which is what they were asking. But I think it's like a sort of a self-employed arrangement, so I think it doesn't necessarily mirror the employer's national insurance. We don't know, do we? So I think we should probably
you may pay a different class of national insurance.
I believe that's right. I think it's a different class of national insurance. So it's whether that's changed or not. It's a very good question. We all have accountants, I guess, who will be grappling with this and will be able to tell us the answer when they do our practice accounts, I guess. Any other questions come through, Gandhi?
So a commentary from Moja Marie about employers must continue to pay employers national insurance on earnings of employees who've reached state pension age. This is no secondary employers contributions. So a bit more clarification in terms of that, I guess. I think in terms of further quotes, so we've not had any more questions come through from the group. I guess ultimately, I think there's going to be lots of questions around what comes moving forward for general practice. And I think one of the key messages, I guess, I would hope that we get across from this is, yes, there's lots of detail as ever. There are still some questions about whether or not general practice will be in some way excluded or mitigated from the NI increases, because there was a comment made by Rachel Reeves around public services not contributing in the same way to the NI increases, because it seems counterintuitive to do so, because obviously that's the biggest cost. But we don't know if that will apply to the NHS, and we don't know if that will apply to general practice, which is sometimes considered not part of the NHS. You know, independent businesses providing services to the NHS itself is slightly different to the NHS as a whole. But I think there's still more detail to come. I think if people do want more information, highly recommend, you know, if you do want to have a chat with Muffadul and stuff, feel free to do so. If you've got some more information you want to have on a more specific basis, I put his details there, mt@everlongwealth.co.uk.
Yep.
Feel free to have a look at that and things if you want individual details and stuff. And I'll put the links to that down below in the chat, along with the links to the document itself. Anything you want to comment on, Andy?
No, I guess just in terms of overall impressions, I mean, I think it's potentially quite damaging for general practice in terms of the minimum wage and national insurance contributions. That will take a big chunk out of practice budgets, unless that is mitigated or made whole by the government and NHS England, in which case the budget would not be as harmful, and actually those headline increases in spending to the NHS, whilst fairly modest, would be welcome. I guess that's where I would land with it. And some of the changes to kind of personal taxation could have been a lot worse as well. So I think that the harms could be mitigated by action from the government. That's how I'm sort of left feeling about it. But if they're not, it's a big problem in terms of making that whole good. Do you have any final thoughts, the two of you?
I think very much, you know, as you say, Andy, I think, you know, it does seem quite counterintuitive to sort of give 22.6 billion with one hand and then take at the same time by increasing the cost burden to general practice. So, you know, it will be very interesting to see how, because, you know, with budgets, you know, we're within sort of, we're about, you know, 27 hours post budget at the moment. Often with these things, it takes a few days for people to digest really what's going on, and then really for the X-ray level of analysis to start, and to actually for people to really drill down on exactly what does that mean. And then often you do find that if, especially with the last disastrous budget of Liz Truss, you saw that actually it was unwound pretty quickly because markets, you know, reacted in a certain way. So it'll be interesting to see what the wider perception of this is. So far, looking at what markets have done today and looking at what markets did yesterday, they don't seem to be spooked in any way with what's happened. You know, it all seems to be quite sort of sedate at the moment. Let's see what happens. You know, it's always the aftermath of these things always leads to more questions as well.
Definitely.
Good.
And I think if anybody watching this does have further questions that want us to tackle, do let us know. Stick them in the comments, and we will try our best to come back to those later down the line. I keep an eye on the comments for normally a week or so after, you know, the live streams go out and things, to respond to what we can. You know, thank you, Muffadul, for joining us tonight. I know it's been a bit of a late one and stuff, helping us navigate this really complex area of finance, because it's definitely not in mine and Andy's wheelhouse. Just a reminder, we are not giving you any form of financial advice in this particular live stream. Do take your own decisions. And if you do want particular advice, speak to an IFA, such as down below me, Muffadul and things. And we will absolutely catch you in the next episode as we take hands to your primary care and learning. And if you want to see that data episode that we've got for next week, check it out right here. Catch you next time. See you later.